Aditya Jyot 24/7 at Trauma Center, where it's located in the Aditya Jyot Eye Hospital, Wadala, Mumbai. And it is paining to see so many injuries happening in the road traffic accident, happening at home, where children while playing with a toy gun injure the eyes, and also at workplaces, where we had a patient from factory where the wine filing went in the eye and damaging the eye. And then the worst thing which I saw, which has happened a few days back, is in Azad Maidan. Some student girls from Pune were getting trained for using the air gun, and then they were doing it in Azad Maidan without any permission, and I don't think any permission will be given. And then the poor boy, 27-year-old man who was working in a company as a peon, was walking by, and then he was injured, and that eye was totally torn into pieces by the pellet, which is he was like a bystander or a onlooker, and he was going. And then they finally found that the students were practicing, which is totally not acceptable, and the FIR was filed in Azad Maidan police station, and the patient was brought on a Saturday evening to Aditya Jyot, and our duty doctors examined, eye doctors, and we have a 24/7 eye care. And that's so on a Sunday in the morning, after doing the CT scan, locating the pellet in the eye. The pellet had torn the front of the eye, the center of the eye, and the back of the eye, and also damaged the retina, and it was lying there. And then emergency surgery was done, and we could save the eye because we could suture the cornea, the sclera, then remove the traumatic cataract, and also the vitreous hemorrhage, and remove the pellet, repaired the retinal tear, and then again there is some detachment which we are going to operate again. And I think injury should be prevented. And now so happened yesterday we have this my friend from Srinagar. He has come with a pellet injury. He is also having a problem where the corneal wound, the pellet had gone through center of the eye, and then it went into the lens, and then it went into the back of the eye. It has produced vitreous hemorrhage, and then it has also produced it has gone behind in the globe. We did a CT scan. There is no pellet inside the eye. The pellet has gone from front to the middle of the eye into the back of the eye, and we have decided not to touch the pellet because it has gone out of the eye. But the eye has to be repaired, and you can see the whitish mat. That is the cataract lens, which we are going to do remove the cataract and also do a lens implant. Simultaneously, I will do vitrectomy using a sutureless technique, where we remove the vitreous hemorrhage and also do the repair of the retina. And I hope the center of the retina called macula and the center of the eye called optic nerve will be okay. And if that is okay, then the vision can come. And maybe you will need some treatment for the cornea once the cornea scarring happens, and we have to probably do something so that finally we hope to restore the vision. And he's a young boy. You tell your name, how old you are.
Srinagar. Got pellet injury on 19 March 2019, and I came from JNK. Yeah.
And what is your plan? What do you want to do in future?
See, I want to become a doctor, and unfortunately this happened.
Yeah, but still you can become a doctor.
Yeah, sure.
And आप अंकल हैं, आपका नाम बोलिए, आप किधर से आए हैं?
परवेज अहमद दरिशी, डिस्ट्रिक्ट पुलवामा, कश्मीर से हूँ। कश्मीर में हो रहा है इस वक्त हर दिन जो पैलेटिंग वहाँ से हो रही है, वहाँ से जब पैलेटिंग होती है तो बच्चों का जो मुस्तकबिल है वो बहुत ख़राब हो रहा है, क्योंकि आम इंसान से चाहे बूढ़ा है, छोटा है, बड़ा है, रास्ते में पैलेटिंग यूज़ होता है तो इंजरी होती है। थैंक यू।
आपको इधर कौन भेजा?
डॉक्टर सोहेल फ्रॉम श्रीनगर।
Okay. So wish you all the best, yes. And I hope we'll repair. So this is the center of the eye, and the pellet has gone through like this, and then through the center of the eye, and then you can see in the center, this is the optic nerve, and that's the center of the macula. So we don't know what is the physical damage, because we can only do a sonography to see the retina is in position. The whole thing is filled with blood. The lens, we are cataract, we are going to remove the lens and put a artificial intraocular lens, which we will do. And I think surgically, this is what I want to convey through this video, that surgically we can repair, and then the vision can be given by the Almighty. But I think overall, I pray God that we should prevent injuries, any type of injury, whether happening in the domestic or in the road or at in the factory or in the anywhere which is happening, and people should be extremely sensitive and probably find out how to prevent eye injuries. Thank you.